Our society is not very good at accepting and discussing serious illness and death. So when they see palliative care or they see our title with end of life in it, it turns them off and they don't realize that the main goal of palliative care is pain management, to ensure that no patient has to be in pain when they don't need to be. So often that's the case. I'm Yolande Nanyar-Carr, Executive Director with the Greater Washington Partnership for Palliative and End-of-Life Care.
How are you?
Good. How do you think it went?
It went really well.
The partnership is dedicated to promoting the efficacy and utilization of palliative care in the healthcare setting. We do provide professional education training. We also provide public education. We are outreaching to consumers as well. And then the third field is in public policy. Most people don't know that physicians are not trained in pain management. It's important that we educate healthcare professionals.
It really is a matter of us as professionals to learn how to manage people's symptoms better so that they can enjoy the life that they have left to them. It's not really all about death, it's really all about living. And it's living to the fullest for all of the time that you have.
So basically, you're willing to say that palliative care actually might be a way of prolonging life. It is, in a sense, treating symptoms without necessarily treating the underlying disease, but it is actually a way of prolonging life. And the entire gist of what it's all about is keeping people as happy and as healthy and as functional as we can.
What I'm hoping is that they recognize that they're dealing with more than just the science of medicine, but that this is the science as applied to humanity, and that human nature or humane nature is something that they hope to develop, as well as to develop their knowledge and their skills.
I think that's very important, to look at what's really ailing the patient from their perspective and address it in their terms, not in medical terms.
There comes a time when we need to be able to say there are no other medical treatments that are going to help us. Then what do we want to do with the rest of our life? And how do we want to spend it? You want to make sure that you can continue the quality of your life as best as you can that suits you. And palliative care helps you to do that.
Hey, it's treatment time, huh?
Ellen Fink-Samnick is a social worker at the Virginia Hospital Center. She works with people who need a ventilator to breathe. When it becomes clear that a person is not going to get better, difficult decisions are made.
The first thing social workers learn in their training is patient right to self-determination. You can't help someone move forward or help them feel comfortable with a situation until you, the clinician, understands where they're at in their thought process and belief process. And that certainly applies when you're working with patients and families.
What I think is really difficult is how do you engage them in the conversation, that you can't use the same techniques and the same tools and the same messages if you want a Latino or an African American or a Chinese to open up, because there are cultural contexts for those discussions. And they don't usually happen as we are sitting here talking one-to-one.
I'm Dr. Acko.
Sometimes it will be a taboo, because as a children, if you mention this to your parents, now they'll think, are you curse me to die earlier, or what are you talking about? So it's a taboo. You must be very careful. I'd rather suggest through the third party, like a social worker or medical doctor or lawyer.
What language do you speak? Tell the doctor what languages you speak.
Spanglish.
Spanglish.
Spanglish?
I think every patient is an entity in his own, and we need to know the patients closely before we can determine how we should approach the problem with them and with their family.
The important part is that people understand that the choice is theirs and that they have a right to talk to their physicians and their healthcare providers to say, this is what I want. No one knows what's best for you other than you. And that's what we want patients to feel more comfortable having these dialogues with their healthcare professionals. If they need to get more information on palliative care, they should go to the GWP website, which is www.gwpartnership.org.